Connected by purpose, driven by passion. This is Children's Healthcare Canada's Spark Conversations podcast series.
Welcome to Spark Conversations, Children's Healthcare Canada's monthly podcast series. This year, the Spark Conversations is dedicated to right-sizing children's healthcare systems. We are grateful to the IWK Health Centre for its ongoing sponsorship of Spark Conversations podcast right-sizing series. I'm Dr. Katharine Smart, host for the podcast series. Today, I'm absolutely delighted to be speaking with Fabiana Bacchini. Fabiana Bacchini is the Executive Director of the Canadian Premature Babies Foundation, CPBF, a journalist and an author. Her journey as an advocate began in the NICU with her surviving twin, born extremely preterm. During this time, she participated in the Family Integrated Care FiCare study, a model that empowers parents to be active partners in their baby's care. Inspired by its impact, Fabiana became a dedicated volunteer at Mount Sinai Hospital in Toronto and an ambassador for FiCare, sharing her story across Canada and internationally to promote more inclusive, family-centered neonatal care. Following her son's diagnosis with cerebral palsy, Fabiana's advocacy deepened. She's worked to ensure that families are not only heard, but meaningfully involved in research and healthcare decision-making. Through her leadership, she's fostered collaborations with hospitals, researchers, and global organizations, advancing parent-led initiatives and driving systemic change in maternal and newborn health. A more fulsome bio for Fabiana can be found on our website, childrenhealthcarecanada.ca, under Spark and then Podcast. As many of our listeners know, Children's Healthcare Canada is on a mission to right-size children's healthcare systems. Such systems should be accessible, equitable, connected, and purpose-built to meet the needs of children, youth, and their families, and the highly specialized workforce that serves them. They are evidence-informed and integrated with other health systems and services. In this episode, we will focus on family partnerships at the systems level, leveraging lived and living experience to right-size healthcare systems for kids. Welcome to the podcast.
Thank you. Thank you, Katharine, for having me today.
Yeah, I'm very delighted to hear from you. And I think it's going to be really incredible for our listeners to both hear about your own experience as a parent of a premature baby, but how that's led to a really impactful career in this area. Just to set the context for our conversation, can you tell our audience a little bit about yourself and your journey?
Sure. My journey really started when I delivered my twins. One was stillborn, and Gabriel was rushed into the NICU, where he spent 146 days. As you mentioned, he was born at 26 weeks. And we spent all that time in the hospital. And that time we were invited to participate in a research study called Family Integrated Care, where families were invited to really be part of the care. So we were seen as part of the healthcare team, making decisions. We had education sessions every day. We had peer support. We had mental health support. So really empowered me to advocate for my son, even though I didn't know those exact words at that time when things were happening. When I was invited to present my son in medical rounds, I didn't know what that was doing for me while I was there. But I was so grateful that I was part of the team, that I was there as a parent and not as a visitor by the bedside. So that's how everything started to shape for me. When I left the ICU, we had a very long journey because Gabriel had 8 specialists. We had appointments almost every day of the week. And a year later, I decided to go back as a volunteer because I was so grateful for the care that I received. I was so grateful that I had skills and I found my voice to advocate for my son in the community, because the prematurity journey does not end when your child gets discharged. It's just beginning another chapter, a very long one. In our case, Gabriel was diagnosed with cerebral palsy at 20 months old, and we never left the system. So coming back to the hospital where he was part of my own healing, giving back. And I joined the Family Integrated Care Steering Committee, and I start disseminating this model of care with the team, the research team. And I had no idea back then that involving families in the care of the babies was not a standard of practice. I thought, wow, that's how it is. But I realized it wasn't, and became my passion to empower families, support the team to change practice in hospitals so families could be involved and have the same opportunity that I had to be involved in my son's care, to be a parent in that very painful and difficult circumstance that we live when our babies are in the NICU and following discharge. So I really made a commitment to go back. I didn't know I was going to become an advocate. I didn't know I was going to take this role. It was just one thing end up leading to another thing to where I am today, 12 years later.
What an incredible journey, and how you took such a challenging time in your life and really turned it into an opportunity to have a huge impact for babies and their families. One thing that you said that really struck me was that you were there as a parent and a partner to the team, not a visitor. I think language is really important. So can you maybe tell our listeners a little bit more about that concept and why it's so important in the work that you're doing?
Well, that became a big thing for me as personally, but also as a professional representing families across Canada in NICUs. We always say parents are not visitors, right? When you look at hospital policies, especially during COVID and post-COVID, we had the parental restrictions that parents could not come to the NICU, or they have visiting hours. Oh, you can come to see your baby from 2 to 4, or you have from 9 to 5, and only one parent visiting. Even parents said, oh, I'm going to visit my baby. We are not visiting our babies. When we give birth, we expect our babies to come home, and then you can be a parent at home, do whatever you want with your baby. But now you give birth and your baby's in the hospital. We are still the parent. You're just parenting in a different environment, and it's a learning experience for us. The healthcare professionals, especially the bedside nurse, has to teach us how to become a parent in that environment. How can we be involved? How can we change a diaper? Because it's not as simple as changing a diaper at home. We have wires and have the monitors. Babies are intubated. You're scared. Baby's so tiny. How can I even handle that baby? So we need to learn how to be a parent. So the healthcare providers have this crucial role in teaching us how to do that in that place. But first is to change the culture of the unit. Parents have to be embraced into that environment. We are just changing location. Instead of parenting my baby at home, I'm parenting now in this unit, which is in your hospital, with your support, because we cannot do alone. You need guidance, we need advice, we need coaching, how to be there. But the culture of the unit is so important. How we Oh, are you coming today to visit your baby? No, I'm coming to stay with my baby. Right? The visitors are the extended family, right? The aunts, the neighbor, or the friends. The parents are the parents, and they should be treated as such. So, our big advocacy at the Canadian Premature Babies Foundation that parents are never visitors, and
Yeah.
our dream is to change policies in every single hospital, that we have a separate paragraph on the hospital policy for parents whose babies are in the NICU, particularly adult hospitals who have NICUs, whether they are large NICUs or a 3, 4, 6 bed NICUs. Parents should have a different paragraph in the policy that states the difference between a visitor and a parent, and what is our role and how much access we have. 24/7 access is so important. Parents can decide if they can be there 2 o'clock in the morning because they work on a day shift versus being there in the evening. The parents should decide when they can be there, and not the hospital. Oh, just go home, your baby's fine, we take care of your baby. Just paternalistic approach should not be a rule, should be an exception for when parents can really, really not be there. But parents should be expected to be there, because we know, excuse me, we know the long-term outcomes for the babies and the parents when they are involved in the care of their babies from birth.
Yeah, I think what I love about that is it's such a simple statement but it encompasses so much, and it's a real shift in perspective and the importance. So, you've spoke a bit about that, about how this impacts outcomes for babies and families. So tell us a little bit more about that. Like, obviously this is on the surface, people hear it, think, yeah, that makes sense, that's nice, but it's not just nice, right? It's essential to the outcomes of these babies. So tell us a little bit about that. What changes when parents are there as caregivers for their child?
Well, it's absolutely essential. There's so much evidence all around the world about the impact of especially skin to skin on babies. It's not a nice thing to do. It should be seen as a medical intervention, because it is, because the skin to skin helps the baby's regulation, breathing regulation, heart and temperature, and parents minimize the stress. So why we are not doing it? So, family integrated care, the results of the study that came out in 2013 show that when parents are involved in the baby's care, the shorter admission, better self regulation on the babies at 18 months of age. So, it's a longer term impact. It's not only for the time the baby's in the NICU. There is less retinopathy of prematurity, which is a terrible condition for our babies. There is less parental stress. So, the benefits are there. So, why are we not doing? Why do we have to keep proving parents should be there? There is
Mhm.
all this, they gain weight, more weight. They go home with full breastfeed. So there's so much to it that we are,
Absolutely.
and that I question like why we're not doing it, because it's,
Yeah.
it doesn't cost millions of dollars.
No.
It's
No.
it's it's a low cost interventions, but it's a culture shift that has to happen in
Yeah.
the hospitals and in the system.
Well, and what's amazing, I think, about what you're talking about, right, is what's very clear is the benefit to those babies individually, right? Their outcomes are better. They're in the hospital for a shorter amount of time. They're healthier. They have less complications or fewer complications, and then they have better developmental outcomes. But each of those individual aspects of improved outcomes for that infant also translates to systems improvements, right? We're in a resource constrained environment, so that prevention, those fewer days in hospital, less medical complications, less developmental challenges also mean less system utilization as that child goes on. So we should not only care about it because it's the best thing for that baby and their individual outcomes, but there's a huge systems impact. And I know in your situation, you've made that shift, right, from that individual advocacy for your baby and then for other babies and their families, and now you have much more of a systems focus where you're trying to make that impact at scale. So tell us a little bit about why you shifted your focus from that sort of smaller scale of your child and then perhaps the local level you were on to what you do now.
I think it was an organic transition from my individual experience and advocacy to a system level. I feel that every family, every baby should have the same opportunity to thrive no matter where they are born. If they're born in a big city or if they're born in a rural, remote area, they should have the same opportunity. So my passion came from that. Why is my baby a privileged baby? Because we live in Toronto and we have access to the best hospitals and healthcare in the big city versus a child who was born Northern Ontario has to travel 5-6 hours to access an appointment. Like it's for me, it's like, okay, why is that? Why does this happen? Why don't we have equity? So I think that came my passion for the work that I do today. And I started traveling across Canada with my work, going to from hospital to hospital. And I noticed there is no standards of practice when it comes to family engagement in NICUs specifically. Each hospital, even hospitals across the street from each other, have different practices. We have no protocols from skin to skin that is standardized across the country. Some hospitals have protocols for skin to skin, other hospitals don't have protocols for skin to skin. So why is that happening? Why in a country like Canada, that we are a developed, rich country, we have those disparities? Because a family who can provide the breast milk for the baby, the babies will have outcomes. Why can we not standardize this practice and empower families and educate healthcare professionals to show families this is hard work now? Because let's not kid ourselves. breastfeeding and pumping when they're in their ICU is hard work. It's exhausting. It affects us emotionally, mentally. But with the right support, we can do that. And how many moms or parents would say, I don't want to do this? If you knew your baby's health is going to be impacted forever, because we know the breast milk impacts the life cycle. So if you want to save money in the system, if you breastfeed your baby, you're going to have a better you're going to age better when you're old. Like, there's so much evidence. So why you're not empowering parents to do that? Why you're not educating the parents? Why are we rushing parents out of level 2 NICUs to give baby a bottle formula because you need that bed to be released so the next baby can come? We are not thinking when the baby's 30, 40, 50, and you're going to age better and cost less money to the system than, right, if the baby's formula fed, especially our babies. We have 30,000 preterm babies in Canada every year. A lot of our babies, like my son, will be using the system forever because Gabriel's complicated. He has a complex health needs. So my son probably have cost millions of dollars to the system, right? We are part of a study that, yes, maybe we would have more different outcomes if Gabriel was part of family integrated care from day one instead of day 8 of life. We don't know that, but I made sure Gabriel was breastfed I provide breast milk to Gabriel from day one. Why can we not empower every family to do that? I think that
Yeah,
is my
absolutely.
big question and my big passion to work with the system. So we are working very closely with the EPIC and the Canadian Neonatal Network to bring parents' voices to the work that they do. That network is amazing. It's an amazing model for Canada. They measure outcomes for every single baby was born in a level 3 NICU in Canada. So we know the outcomes for those babies. Now we are adding family engagement as a measurement for outcomes for those babies. So we are skin to skin is the first variable. And this is how we can possibly change system when parents are
Yes.
involved, co-designing, not coming just to share stories, because it's very nice to share story. We empowered, we inspired the crowd. Oh, that's a beautiful story. This was, not as a positive experience, but you transform your experience into something so beautiful. And then what? Then you go back to
Yes.
your hospital and you get caught up on your everyday tasks, and who cares?
Yeah.
Right? So it's not just to come and share stories, it's to co-design, it's to bring the parents' voice to really listen and work together and find solutions together, because we bring a different experience, we bring a different background. That, I'm a journalist, I love telling stories. Other parent is an engineer, can bring a different perspective into the system in a full, true collaboration where we can make changes together, and better changes, because
Yeah.
we are much better working together, right? It's the
Oh,
puzzle. We bring
absolutely.
different pieces to it.
Yeah, for sure. And I think you've touched on so many really important things, I think, from what you've said, and they really mirror, my experience as a clinician. I've worked a lot, both in level 3 and level 2 and level 1 NICUs, as well as rural and remote settings where there's no nursery and we've had, unexpected premature deliveries. So I've seen it from the pediatrician side, not perhaps from the parent side. But, my experience has really mirrored what you've shared. I was always interested in these things you've been talking about, so wanted to implement those things for my patients. And it was hard because what you've said, when there's not a standard of care that's been universally accepted, and some of these things are, newer research, and they're not yet implemented in the hospital you're in, it is very hard to get people to do them. And I think that's why what you're talking about, right? Let's take the evidence we have. Let's create a standard in Canada that all babies should be getting, because it's not just nice to have, it's essential, it's linked to their outcomes, and that needs to be implemented in all hospitals. So we're not, as individual clinicians, trying to fight these fights on behalf of our patients, because it takes forever to get these small changes. I remember in a unit I worked in, trying to get a fridge for express breast milk was like an unbelievable battle, which seems crazy, right? How could that be? But because it wasn't at that point seemed to be an essential thing, it wasn't something that people wanted to support. So I think this work that you're doing is so important. And I love that you're connected to a research network as powerful as EPIC. That's then, as you said, linking directly the outcomes of these babies to these initiatives you're talking about, because that's how we get change at scale, right? We get it by showing it's essential, by showing the impact, and the fact that families are there alongside, informing, co-designing, and showing that, not surprisingly, parents often know what's best for their kids, and they can provide that in a way that professionals can't. So I love that that's where you are. I think it's, in some ways really surprising that how hard probably these battles are to fight and how hard change can be at a systems level. And I think, we all who are in systems recognize that, but it's voices like yours, I think, that bring that about. So I'd love for you to maybe tell our listeners a little bit more about where EPIC is sort of focused in terms of these interventions and what you think is the most important things that we need to be thinking about when it comes to scaling, that excellence in care for all premature babies.
So EPIC works, they have 7 different working groups
Mm-hmm.
to measure different outcomes for brain health, gut health, hemodynamics, infections, and now we added this family engagement. So in my dream world is to have hospital accreditation for family engagement. You have your stamp at the door because hospitals love those. We are
Yes.
a baby friendly hospital, or you are a magnet accredited hospital. So why don't we have in Canada a family friendly hospital? I don't know the name of it, but I think we are working towards something like that with the EPIC team. The success of EPIC is the leadership. The leadership embraced family presence in all the work that they do. And I think that is an incredible power for change in the way they see families not only coming to share their stories, but really engage us in quality improvement projects, co-design quality improvement projects, present posters at conference, which it doesn't seem to be a big deal, but it is a big deal because we are bringing that different experience and voice to the system. And I think unless we sit down together to build the table and not to be invited to the table, that is a shift that has to happen in the system level. And I think that's the only way we're going to accomplish what we are aiming to, especially with this incredible work that Children's Healthcare Canada is doing for the right size healthcare system. We have to do together. We have to advocate together. We have to change policies together. We have to fight for funding together because our children are the future of this country. Right? We only 20% is the representation of children among our population. But this 20%, as cliche as it sounds, is 100% of our future. So why you are not seeing that?
Yeah.
And
Absolutely. It's wild, isn't it? Really?
it is wild, but when you invest in healthcare, you're investing so much more. You are investing in the well-being of an entire population. You're investing in these children who are going to take on the country because we are not going to be there,
Yeah,
right? Like, why
absolutely.
are not taking care of this? And it's a short thing. And I always think about, all the decisions that are made in a NICU in terms of funding, for example. We are only looking at funding from that NICU. We are not looking at what's going to happen to this family when the family leaves the hospital. Okay. And a simple example of that is like, if you think about RSV, our babies are so vulnerable to that virus. Okay. Like, because they have underdeveloped lungs and they can get very sick. They can be readmitted in hospital, go back to breathing support. Okay. So there is a solution for that. So why we are not taking the power to provide a prophylaxis to these babies so all babies have equal access to a simple drug, because it's going to save money to the system on the long term. Is going to avoid parents falling into mental health crisis, because when our babies get readmitted in hospitals, it's hard for us. We lose days of work which means we bring less income to the house. One parent has to become a caregiver. So it's a cheap saving, as we would say in Portuguese, in my own language. You're saving a little bit of money here, but you're not thinking about, oh my God, like the long-term outcomes. If this baby gets sick
Yeah,
and it's going to have asthma, it's going to have a long-term impact on their lungs. It's for life.
absolutely.
I think
And
that system
yeah,
has to change, to shift the mentality and invest more on early beginnings for long-term outcomes. That is what I would say, to invest now, because
yes.
you're investing for life.
I'm with you 100%. I think so often this is the missing piece that so many people, policymakers, don't really understand is what you've been talking about, that link of those early childhood beginnings, that first few years of life, to that life trajectory, to chronic disease, to mental health, to how they're going to be able to contribute in their communities. These things begin in those first days and months and years of life. And you can't get that time back, right? There's no doing it again. So I absolutely agree with you. And I think your advocacy is really impactful and so important. So I want to give you a chance just to maybe tell our listeners a little bit, where to next from here? What's coming up for you? Or what are you hoping to achieve in the next few years in your role?
So we really want to continue to advocate for parental presence and involvement in NICUs across Canada. Our goal is to have a standardized practice across Canada when it comes to family engagement. And who the family is defined by the family, not by the system, or
Yeah.
only the mother and the father can come, because there's not always mother and father. There is mother,
Mhm.
single mothers. And so the definition of family should come from the family and not from the system. And families should have 24/7 access to their babies and involved in the care of their babies, receive proper education and support so they can be there for their babies. And we look at long-term outcomes of that. Standardized neonatal follow-up is so important. So we also work with the Canadian Neonatal Follow-up Network to make sure all these babies have the proper care and developmental assessment once they go home, because the journey continues for a long time once they get discharged from the NICUs. So this
Yeah.
is the work that we will be continued to do. We are launching a toolkit for implementation of 13 recommendations that we're giving for family presence in the NICU. So this is coming later this year, and this will be a very important document for us to go, unfortunately, from hospital to advocate for that, where that should be a system change. But until we are there, we're going to knock on hospitals' door to implement family presence in their units.
That's amazing. Thank you. And I hope you keep knocking, because you've obviously had a huge impact so far. So before we let you go, I want to give you a chance to give us your 30-second elevator pitch, what you would say to policymakers regarding the uniqueness, impact, and value of prioritizing children, their health, healthcare, and health research.
Well, I would say that investing in this right-sized healthcare system is not only a moral imperative, it is economic sense. We have 30,000 babies born in Canada each year before 37 weeks gestation, and our babies cost millions to the system. And there are very low cost interventions like family integrated care, skin to skin, the provision of breast milk that improve outcomes and reduce costs. So, but we really need the system to support these evidence-based practices so they are standards, is equitable, and include families at the table from day one. We can all give these babies a better beginning for a better long-term outcomes that will be sustainable throughout their life cycle.
Thank you. That was a beautiful summary of the work that you're doing and your vision for healthier babies and families. So thank you, Fabiana. It's been an absolute pleasure having you on our show today. I really appreciate your time and your passion for these littlest of babies.
Thank you so much for having me today.
Thanks again to our Spark Conversations podcast sponsor, the IWK Health Center, for their ongoing support. That's it for today. Thanks for listening to Spark Conversations. To stay up to date on all our Spark offerings, including upcoming podcast episodes, you can visit our website at childrenshealthcarecanada.ca and subscribe to our Spark News biweekly e-bulletin if you haven't already. If you like the podcast, show us some love by leaving us a review and telling your colleagues about us. See you again next month.